we're going to kind of hit you with a number first, and that is that we face a critical challenge ensuring greater adherence among specialty and rare disease patients. And this is going to be a big focus, obviously for what we're going to talk about today is how hub models, how they're kind of built, what are the options out there, and we're going to talk about the advantages and disadvantages of some of those options. Now, according to NORD, the National Organization for Rare Disorders, up to 65% of rare disease patients discontinue their medication. Get this, half of them are stopping that medication within the first year. And these are critical medications for these individuals. So this highlights the unique barriers that these populations encounter, from complex treatment regimens to emotional and psychological hurdles. So Melissa, I have to ask you, is this statistic surprising?
Yeah, I'm unfortunately not surprised, having done this for quite some time. And I think a major driver of this in today's environment is really the value of the treatments that have come out as of late in the last couple of years are predominantly what I call invisible to the patient and the caregivers, meaning that, they don't feel any different. And many are targeted. And the reason for that being many of these newly launched therapeutics are really targeted at impacting the disease and disease progression. They're not necessarily there for side effects. So if we think of the good old days of the, RA therapies in particular, those were something that patients were trying to address full on. It impacted how they looked, how they felt. And in today's environment, that's simply not the case, because if a patient doesn't feel or see or look different, then they do question and forget to take their medication, especially when you're talking about expensive medications, which we also know there's an increase in rise in cost and specialty, particularly in rare disease. Now, I say all of this with the caveat that, of course, if you're dealing with a pediatric indication, you do have a little bit of a different outcome here because you have caregivers, mostly parents, taking care of children who tend to be a lot more compliant and on top of their care. In addition to patients just not feeling or looking any different, I would say that a lot of the medications as of late actually make you feel worse. So I would challenge anybody to look at, especially rare disease and oncology, look at those particular therapeutic areas and try to find a drug that doesn't have fatigue as a side effect or doesn't have GI symptoms as a side effect. And so you're dealing with medications that make you feel worse, so you don't see a benefit, you see a disadvantage. So for those reasons, I'm not surprised by it. And again, just the blockbuster days of the past are gone, right? Now we're dealing with much smaller patient populations. And to your point, Josh, those that are much more complex in managing, they're very holistic in nature. And so this indeed is why patient support programs have to be tailored and robust in today's environment.
Yeah, thank you, Melissa, for that. It's really understanding what defines adherence in these kind of contexts is crucial. And there's like you said, there's just so many reasons why a patient might stop taking a medication. When we look at specialty populations, such as those with inflammatory conditions like RA that you'd mentioned, oncology, diabetes, HIV/AIDS, these represent a small group of patients. So it's actually, with many of these, it's less than 5% of the US population. Yet they account for over 50% of the total drug spend. Now, meanwhile, rare diseases, they affect fewer than 200,000 people per condition, but they collectively are impacting 30 million Americans. So you have like these crazy dichotomies that are going on here. And even Melissa, you've even, in our discussions talked about how, many of the rare diseases are even more rare. Medications, there's a plethora of medications coming out for even orphan drug medications. So there's a lot of change that's occurring. So this rise in specialty and rare conditions, plus the adherence challenges, really affirms the need for pharma to better understand and advocate for effective patient support. So this is why the hub model selection and the measurement are so important, and that's what we're going to talk about with this discussion. Here's another stat for you. Our mission is to really bridge this gap. So Melissa's mission, our company's mission, anyone that's working in patient support wants to bridge this gap, and this is a big one. So 61% average improvement is shown in medication persistency when there's personalized patient support. So that's incredible. So you're helping a significant amount more patients continue to take their medication, giving them the support they need, the tools they need, the motivation, the confidence they need. So by leveraging evidence-based interventions, we aim to empower patients to start and stay on their therapy and ultimately enhance their quality of life and their health outcomes. Because that's the whole point of this. They're taking medications to feel better. Let's make sure that we can keep them on those medications and get what they need.